healthcare is a multi-trillion-dollar responsibility in this country, and not all of those multi-trillions annually come from the federal government, but we have to do our part. We need to make sure that we make it accessible for everybody to have access to not only healthcare, but their prescription drugs and the things that they need so that they can have a good quality of life.
You just mentioned another issue that's a hot button for us, and that's prescription drug coverage. And one of the things that many of us are experiencing is that we purchase drugs under the federal drug pricing program. It's called 340B, and we're able to buy very low cost drugs and then pass those savings along to our patients. And what happens now is that the pharmaceutical manufacturers are taking a very tough stance on our use of contract pharmacies. And when you're in a service area as large as Northeast Valley's, which is 1,000 miles, you know, it's very difficult to work with just one pharmacy.
Oh, absolutely.
And what we've recently seen ourselves having to do is consider terminating, you know, contract pharmacy arrangements, because these pharmaceutical manufacturers just don't want to ship drugs to multiple contract pharmacies. So we have, I think there's a bill working its way through Congress now, and we hope that'll be a fix. But we do need help on that front too, to preserve the ability of health centers to access those 340B drugs, both in our own pharmacy, which we do at Northeast Valley, but when we have contract pharmacy arrangements, we do them for geographic accessibility of patients.
Well, you touched on how intricate and complicated legislation can be, because we have to look at the entirety of the situation, and obviously making things simpler. The public wants us to do that, and we always want to make it as simple as possible, yet still being effective. And for us to have to make sure that accessibility, not only to healthcare, but to people's medicines, etc., is to make sure that we have the right size of flexibility and responsibility, so that we have as many players on the field as possible to participate, for example, with an NEVHC, and provide that continuum of healthcare for your patients.